Our kids are a resilient bunch, and I am very amazed and impressed at how well they've navigated through this.
We can tell from our calls to our mental health helpline that Albertans are really struggling with substance use, loneliness, anxiety from the pandemic, and grief over the loss of loved ones.
It's pandemic with a compound and loss of jobs, a compound and the social issues, and then George Floyd from the US. I think all those things certainly have taken a toll on our officers.
We're advocating as soon as possible to return people to the workplace.
Even to adapt is a privilege because a lot of people don't have the ability to work from home.
Really, what we've seen is a real disastrous impact on people's sense of well-being and sense of safety.
In the country, there's never been a protest for kids being raped, human trafficked, or child pornography. But there's been how many of them for masks? Like, I don't understand.
We're going to see a wave of mental health and addiction issues come out of this. And I think as a community and as a province and as a country, we have to recognize that and find ways to help people that won't break the bank.
There was suspicion especially from the seniors in our community around being put to the front of the line for this brand new vaccination. And so there was this suspicion around what's in there and why are they putting us first? They never put us first.
Hi, and welcome to Our Mental Health, a community collaboration webcast series. I'm Leslie McDonald. 1 year in, it's almost surreal that this pandemic continues wave after wave, and it feels like there's no real end in sight, and that's even with the hope that comes with a rollout of vaccines. The concern now is that when we get through the COVID pandemic, we'll be dealing with another wave, this one around escalated mental health issues. It's time for change. So what is the pulse of mental health in our community? We begin a 3-part series that looks at different sides of the issue. This includes a live stream event where we include you in the discussion and we give you access to mental health expertise in a whole cross-section of areas. But first, we start with a high-level view from top leaders in our community. Leaders we've just seen in our opening in the areas of education, business, police, health, politics, and minorities. And we bring you a panel of leaders running organizations that provide mental health services. They're all Edmonton-based, but the challenges that they're grappling with are the same as those being grappled with in other communities around the world. This webcast series was begun as a lecture series presented for nearly 4 years by CASA Child, Adolescent and Family Mental Health. It then went online as a forum on the impact of the pandemic on mental health. We have now re-released it and relaunched it as a collaboration on partnership with CASA, Yes Youth Empowerment and Support Services, the Glenrose Rehabilitation Hospital Foundation, and Kickstand, a new youth health initiative. We'll be collaborating with other organizations as well to bring their expertise to each webcast. And today, that includes Alberta Health Services. And our ongoing media supporter is Global Edmonton Television. Our goal is to bring you reliable, accurate information to inspire conversation, hope, and wisdom. We start with a discussion with our panel members. They are Bonnie Blakely, the new CASA CEO. She comes to us from Saskatoon, where she held several diverse leadership roles in the public and private sectors, including as Vice President of the Saskatoon Health Authority. Bonnie says she knew from an early age that she wanted to serve the social fabric of communities and families. She is a change agent, a recipient of the Regina YWCA Woman of Distinction Award, and is married with a blended family of 7, where she has lived experience with a mental health care system. Margot Long is President and CEO of Youth Empowerment and Support Services, also known as YES. Before that, she was a partner at Insight Marketing, where she provided strategic oversight for countless Alberta businesses and not-for-profit organizations, including YES. She also serves on the board of the Mental Health Foundation. Margot, too, is a mother with lived experience in mental health. Mark Cortheus is president and CEO of the Glenrose Rehabilitation Hospital Foundation. Prior to that, he was president and CEO of the Alberta Mental Health Foundation. He's a board member of the Edmonton Community Foundation and TELUS Edmonton Community Board, and is engaged in exploring mental health issues with his own podcast, Confronting the Madness. Pamela Liversidge is the Executive Director of Kickstand, formerly known as the Alberta Integrated Youth Services Initiative. She comes to Alberta from British Columbia, where she had 20 years of strategic level policy and program experience in the areas of Indigenous housing, child welfare, mental health, and substance abuse. She started her career as a youth addictions worker, and her heart has always been working with youth. And last but not least on our panel is Mark Snattersey, Executive Director of Addictions and Mental Health in the Edmonton Zone for Alberta Health Services. Trained as a pharmacist, his clinical background was in psychiatric pharmacy at Alberta Hospital. With a focus on adult mental health, forensic psychiatry, and geriatric psychiatry, he developed the curriculum for the University of Alberta's Faculty of Pharmacy, where he was also an adjunct professor. Welcome, everyone. Now, before we begin this discussion, I'd like to quickly get into some background on each of your organizations, the structure, the resources, and who you serve. So, Mark Snattersey, let's begin with you. Tell us about the scope of your department.
I work for Alberta Health Services. Obviously, that is the provincial health authority. We deliver a lot of the direct frontline addiction and mental health services. My role, I oversee all of the addiction and mental health services in the Edmonton zone. And I have colleagues across AHS who oversee the services in the Calgary zone, the Central zone, the North and the South zone. So we deliver everything from inpatient care in hospitals to community clinics to school-aged services for children and specialty programs such as forensic psychiatry and eating disorders. And in addition to the services that we deliver directly, we also provide funding to many of our community partners to also deliver addiction and mental health services in the community.
Yeah, community partners on this call as well. Pam, we're going to move to you next. You have a really exciting new initiative for youth. Can you tell us what it's about?
Yes, of course. So, we all know someone who struggled to access mental health supports for their child. Even those of us that work in the system can struggle to find supports for people we love. So Kickstand is a new initiative that was created to support young people aged 12 to 25 years old find the support in the easiest way possible by coordinating and connecting a variety of service providers in a single location. Services include mental health and substance use supports, primary health care, peer support, and a variety of social services through partnerships with existing providers, including the ones that I'm joined by today here. So really, the goal here is to support easier access and navigation to holistic care for young people. And all of this will be done through a virtual clinic that we're calling Kickstand Connect, which is launching very soon. Kickstand is also an online hub for young people and families to get resources and tools that they need when they need them on a variety of wellness topics. And Kickstand also helps to support young people to have more good days through a free More Good Days service that provides a daily dose of inspiration and advice straight to phone via text message. We've worked with Dr. Vincent Agyapong here in Edmonton to help support this service to happen. And everything that Kickstand has been developed, or everything that Kickstand has been developed through extensive engagements with young people and families, really across the province, who have told us what they need and want in terms of better supports for mental wellness.
Wow, really exciting. Thanks so much, Pam. Mark, I'm going to call you Mark K. So I get the two, Mark S and Mark K. Mark K, we don't think of the Glenrose in terms of delivering mental health services, but we're going to talk a little bit later about what that link is, and also about your personal passion for mental health with your blog. So can you fill us in a little bit on how that looks?
For those that don't know, the Glenrose Rehabilitation Hospital is the largest rehab hospital in the entire country. And the only one in all of Alberta. And while it does serve a complex array of patients of all ages, the hospital itself also does support geriatric psychiatry, child and youth and family psychiatry, as well as some research around novel treatment modalities for post-traumatic stress disorder, specifically for military families. Previous to my role with the Glenrose, I was involved with the Mental Health Foundation, and mental health has always been a very personal passion of mine, through both lived experience and also deep family experience as well. And so recently I started a podcast called Confronting the Madness, exploring the psychological issues of our time, so that we can have discussions with an array of individuals from across the world, just to really try to understand mental health better and try to find a path in which individuals can find the best access to care possible. So,
wow, thanks, Mark. Marco, I'm going to go to you next. I thought that I really understood what YES was until I started talking to you, and it's quite big in terms of the services that you give.
Yeah, YES provides immediate and low barrier overnight and day shelter, temporary supportive housing, and individualized wraparound supports for young people aged 15 to 24 who are experiencing crisis and housing instability in Edmonton and surrounding areas. We serve around 700 youth a year that come through our various programs. We have around 85 staff, and about 4 years ago, we refocused our organization around being intentional to identify, be aware, and address the adverse childhood experiences and childhood trauma that young people were experiencing. And what we realized is one of the major barriers for reintegration in feeling like you're a belonging, valued member of community. And so we've really looked at how to support young people on that journey. We've hired counselors, we have psychologists within our programming who focus on really helping the youth understand even simple things like identifying what emotion they're feeling and how to regulate those emotions.
Mm-hmm. There are a lot of synergies with YES and with CASA. Bonnie, you're fairly new to the organization, but wow, have you ever integrated yourself quickly? Give us an idea of the scope of CASA, because it is quite large.
Yeah, thanks, Leslie. And to my partners on the panel who I'm getting to know, CASA serves about 4,000 children, youth, and families every year. And we're a not-for-profit organization, basically delivering mental health services to children, youth, adolescents, and their families as an extension, with a real belief that that service for a child or for a youth that has a mental health issue also has to extend to the family. We know that when a youth is struggling with mental health challenges, so typically is the family. We really need to provide that whole service. And that's why we're so appreciative of the funding we get, both from the Alberta government and from the Alberta Health Services, from my friend Mark there, because it's just so important that we create that collaborative, because when a youth comes to our service, whether it's a community-based service for children who are school age, whether it's a service that's in-house where we work with Edmonton Public Education to provide services to students who then come in and get to go to school while we help them with complex needs in mental health, or whether it's our trauma services, we really depend on our partners, because those youth that come to us for those very targeted interventions and complex needs also then leave CASA to go into the community or back to other services, and we really need to make sure that those transitions are smooth. So CASA is just one piece in a bigger puzzle here as we try to deal with the pandemic.
Wow, so lots to talk about here. I want to begin the discussion, that we interviewed a number of senior leaders in the community and asked them all the same question for consistency. And we're going to be hearing those answers and some of those common themes and new themes coming up throughout this webcast. But first, what I'd like to do is I'd like to begin with panel members and ask you the same question and get your take from your perspective. So the question is, 1 year into the pandemic, what is your opinion of the impact on mental health on the people that your organization serves, and if applicable, those inside your organization? So Bonnie, let's begin with you.
It's such a big question, isn't it? Certainly for the youth and children families that we're serving, it's actually been a mixed response in terms of the pandemic. What we do know is that our services have never been more in demand. And at the same time, we've tried to deliver them at a time of social distancing and trying to make sure people are practicing safely and trying to make sure that, that the service that we're providing is still as effective. What's interesting about that, and I think in one of the clips it's so profound, is that youth are so resilient in so many ways. And some of our youth in central and northern Alberta who may not have had to travel into Edmonton to get the service have found that our ability to go online and to do things in a different way has really, has really resonated with them. So I think, it's been a challenging year. I think people are feeling tired. I think even for those who have adapted, it's starting to get old, including myself. And our staff, I have so much appreciation because through the pandemic, because we provide residential care as well as tertiary services, our staff have been working through the pandemic, and many of them have been at work. And it's a difficult thing to ask someone, to constantly be putting protective equipment on to ensure distance. And you can imagine you're dealing with children, and I'm not so sure that as they're eating raisins and drinking juice boxes, they're always thinking about the same things we are about spreading anything. So, it's been a challenge for our team. But overall, what I'd say is I have so much appreciation. Appreciation for how the youth that we've been working with and their families have tried to adopt and adapt, as well as our staff.
Wow, Margot, you want to answer that question?
You bet. Thank you. For us, the effects have been significant and critical and complex. And I know that we're going to be dealing with the effects of the mental illness side effects from this pandemic for many, many years. What we're seeing at the client level with young people that access Yes is an increase of fear, an increase in substance use to deal with that fear, and an increased feeling of loneliness and isolation. The youth that are accessing shelter, for example, have been masked for 12 months. And so it's hard to imagine that, a teenager being in a situation where they're not interacting with their friends, or they have no family cohort within the shelter that they can sort of just be safe and maskless and not be physically distanced. And that has had a real effect, negative effect on their mental health. We're seeing an increase in domestic violence. And so therefore seeing new youth that we haven't seen in the system before this year because of the escalation of fear and anxiety at home. While youth and young people develop tools to deal with what's going on, they see what's going on around them. And there's an increased fear in the community, collective fear and anxiety that's palpable, and our children feel it. We've got that feedback from them, and that carries across to staff. They have very, very difficult jobs. Being a youth worker, I think, is one of the most difficult parenting jobs I've ever seen. And then add the complexity and danger of a disease on top of that. That's quite a bit to deal with. You're worried about young people as well as your own self-care. So it's had major impact on us. And what we're trying to do is help people understand what they're feeling and help them find little things that make their lives better.
So Pam, how is this resonating with you? What are your observations?
Yeah, thank you, Leslie. I'm a bit of an outlier here in the sense that we haven't launched our services for young people yet. So what I can tell you though is, and there have been a couple of comments that young people are incredibly resilient. They absolutely are. And a significant number of them are struggling big time. So, there's growing evidence that young people are being impacted, their mental health is being impacted more significantly than any other age range. So sort of 16 to 24, 25. And I think, if you think about it, there's some really good reasons as to why that is. Young people are typically quite social, daily in terms of just school, or if they're in school, or through work, or, celebrations, graduations, birthdays, you name it. All of that's been disrupted for them. And, many of them are spending a bit more time on social media, which again can be a way to connect, but can also be a way to increase anxiety and stress. So we know that anxiety and stress amongst that age range has gone up pretty significantly through COVID. I mean, we've all been impacted, obviously, through this ongoing pandemic. But I think one thing that's quite alarming for me to see is, for many years, suicide has been the second leading cause of death for young people, which is horrific. It is now the leading cause of death for young people. And so what this means is 1 in 5 young people who die are dying through suicide. And, tragically, we saw there was a situation in St. Albert quite recently. And, I know of many other situations like that. So I think that I completely agree with my colleagues who have talked about the fact, I think it was Margot in particular, about that, so we're seeing increased anxiety and stress right now. But once, people do have a time to kind of really reflect on how their lives have been impacted, we will start to see a significant, ever increasing demand for supports. For a young person, a year in their life is a long time. Like, I don't know if I can barely remember it for myself, but when we think about a year, it's a long time, but it's not a lot. It's not like it is if you're 15 or 17 years old. So that's what, worries me. And in terms of my team, we are not, frontline service providers, but I have onboarded the entire team through this pandemic. So we haven't been able to get together to develop as a team. And so I'm certainly not putting that on the same level as, frontline service providers by any means, but it's been an interesting thing to observe too, in terms of trying to get this initiative off the ground, and we're all doing everything virtually.
Wow. Mark Kay, what are you seeing?
So a couple comments, and not to echo what previous guests have said. I think the last 12 to 15 months, the pandemic's really shone a light on individuals' strengths, and also shone a light on individuals' weaknesses as well. And I speak from an individual perspective, whereby, I think I felt a lot of gratitude at the front end of the pandemic, because, me personally still had a job, my family was healthy. And even though there was uncertainty and ambiguity and a lot of unknowns, I felt a very, very strong sense of gratitude. And I know I spoke with a lot of folks that felt that same sense. On the flip side, there's this rung of ladders where you can, if I'm at a certain rung of the ladder of gratitude, you go down one rung and that person's still feeling gratitude. You could have gone down 5 or 6 rungs of somebody who may have lost his job, but his wife still has a job and his kids are still, and they felt a lot of gratitude too. So I think there was this dichotomy taking place throughout the past year, where there was a lot of gratitude, but on the flip side, so much uncertainty and anxiety, that, as previous panelists have said, I'm not quite sure we're going to really understand the ramifications of that until all of the dust is settled with COVID-19, because I think right now people are still stuck in, if you think of fight or flight, they're still kind of frozen in this state of, I don't know whether I should be moving ahead, staying put, or retreating. And so, I know from the Glenrose Hospital perspective, we're taking a lead on looking at COVID-19 long haulers, not only the long haulers with physical symptoms, but the psychological ramifications of individuals that have had COVID specifically, but that would as well, people that have just struggled psychologically from loss of work or uncertainty with their family or domestic violence. I think all those things are yet to really show itself in emergency departments, primary care physicians, or the data itself.
Mark S., I saved you for last because you've got a big picture on this. You get to see what all the different organizations do. And so what's your opinion? What are you seeing?
Well, as resilient as people are, this pandemic has really created unprecedented layers of stressors that individuals have had to deal with, that families have had to deal with, and that broader communities have had to deal with. And and stressors are additive the longer that you're exposed to them, and they're also cumulative. So the more stressors you have, it wears down that emotional resiliency that people have. And so when you think about the financial stressors, the stress of just worried about your health and the health of your loved ones, the stressors of losing so much of your social connectivity to people. We're a very social people, and a lot of our support systems are based on human connection. And the impact that this social isolation is having on people is very profound. One of the ways we can measure the impact is to just look at the numbers of people who are reaching out for help. And it was quite fascinating in the first, I would say, 6 months of the pandemic. In addiction and mental health, we were gearing up for an expectation of lots of people reaching out for help. But in the beginning of the pandemic, I think people were just worried about their own health. They were staying home. They weren't attending appointments. They weren't even going to their family doctor. But as more stressors were layered on for longer periods of time, we started to see about 4 or 5 months ago this sharp increase that now people are coming out, they're recognizing that they're not coping, and they're reaching out for help. And so whether you're measuring the telephone calls into our provincial mental health hotline, or the phone calls to our crisis team, or the numbers of people walking into our clinics, or the numbers of people actually coming into emergency departments in a crisis and needing an inpatient admission, all of those are on a very, very sharp increase. And it actually frightens me because I don't think that's going to come to an end for quite a few years. I think this is the long wave of the pandemic. We're in the middle of wave 3 of the COVID spread, but the final wave is going to be the impact of the emotional burden that this has plagued with people's lives over the past year and a half.
That certainly seems to be a common theme.
Yeah. And with regards to our people in Alberta Health Services, there hasn't been anybody who hasn't been impacted. People, as resilient as our workforce is, everybody's been asked to do different jobs. And so if you think about the numbers of people who previously worked in medicine or surgery, and now we've had to upskill them so they can work in critical care, or the nurses who worked in an ambulatory clinic who have now been trained to administer injections, immunizations, or do swabbing in the community. There have been thousands of staff who have adapted, who have needed to be redeployed to other parts of our healthcare system to support the evolving changes. And so we have a really strong emphasis on supporting our staff and providing the mental health and emotional supports that they need to continue to be resilient.
Wow. Some common themes in there, and then some other themes, because we talked to a diverse number of group of people. So we're going to begin with some clips from interviews from the first group.
It's become a #1 issue for the business community, and every time we talk to business owners or even employees, or when we're doing our survey work, what we're finding is increasingly week over week and month over month, the discussion starts to relate to the pressure that's being placed on people, the sheer pressure of not being able to convene, of not being able to work together or come together in any way except over a screen. It's exhausting, and it's very, very, it's taking a tremendous toll on our mental health and well-being.
Even to adapt is a privilege, because a lot of people don't have the ability to work from home. Many Black Canadians across Canada, for example, we've done a research with Innovative Research, and what our study highlighted is many Black Canadians end up working in places that exposes them to COVID-19. They typically take transportation. They might not have access to adequate support that accommodates their safety. Mental health is a difficult thing because Black Canadians are 3 times more likely to know someone that have died from COVID-19 or contract COVID-19. Black Canadians reported regardless of whatever preventative measures that they take, they are still highly exposed to COVID-19, and they or their families or someone they know contracted the virus. Mm-hmm. So in terms of mental health, the anxiety, the isolation, the income disparity, all gets amplified, and a lot of challenges comes from that. We've spoken to many communities, and a lot of people reached out to us across Canada have similar issues. And for example, First Nations community, ethnocultural community, religious minority communities, newcomers, they all are experiencing the same. However, for Black Canadians with racial disparity and income disparity and systemic racism, of anti-Black racism particularly, that existed for a long period of time, the exposure to a global pandemic just significantly amplifies what they've already been dealing with.
What we've seen is a real disastrous impact on people's sense of well-being and sense of safety. And there's a multitude of reasons for that. When it's, the folk who were already struggling with mental illness, we've seen an exacerbation of symptoms made worse, and that we've seen lots of crises, lots of mental health crises, lots of suicide attempts, and sadly completions. We've seen lots of overdoses, and a spike in acute, depression, anxiety, psychosis, etc. What we've seen really depends on what their experience is and how supportive the people they live with are. If they're in supportive family environments, it's still tough because we're working with young people, and social connection to peers is paramount, and getting outside of the house is paramount for all of us, but particularly youth who are going through identity formation and getting to be with peers who are having similar experiences to them. But if they're in homes that aren't supportive, that isolation, that inability to express themselves, to be with people who, with whom they can use their name, their gender, etc., talk openly about experiences, and that is, we're 14 months in, and it's so hard with youth in general, and that we're going to see mental health fallout from this pandemic for some time to come. But this pandemic has really been a game changer in how people talk about wellness and how openly they do. And anecdotally, I know there's research being produced already on this, but anecdotally, we see the difference in the sense that, historically, we greet each other by saying, "How are you?" And you say, "I'm fine." And I don't even wait to listen for you to say, "I'm fine," because I move on because I know you're going to say fine. And if you say something other than fine, it trips up the conversation, But now we're seeing people are much more, honest, authentic in these responses, and people will say now, actually, I'm not great today, or it's been, a heck of a week, or it's, those kinds of things. And I think that is huge. If we can hold on to those conversations and keep those conversations and normalize those conversations beyond this pandemic, that will be huge in addressing stigma around mental health and addiction.
Wow. That's a pretty powerful statement, and there are some positive things that are coming out of this as well. So let's touch on some of that. Mark K, you were smiling quite broadly when she was talking about that. Do you want to share?
Yeah, no, and thanks for asking. I thought it was put quite poignantly with respect to people being more willing to share their experiences and unmask themselves about how they're really feeling. And I know for me personally, I've always used my friends or my network as as quasi psychotherapists for myself. And so, you've been, having your friends act as, CBT, cognitive behavioral therapists on your behalf. And that's very, very helpful if you're able and comfortable enough to share your true raw emotions about how you're feeling. And, historically, that's been difficult for individuals to do for fear of being judged or stigmatized. And I totally agree. And I found that as well throughout the past 15 months. I've had conversations, personal psychological conversations with people whom I would have never thought would have had those. And I think that's been very cathartic for us as a community and as a society. And I completely agree that if we can take that with us going forward and not always trying to pretend that everything's okay when it's not, or trying to put on a mask of who you think people think you should be, will be very beneficial for us and individuals' mental health going forward.
Yeah, and that was a common theme with you as well, Marcus. Where you talked about how stigma has held people back from getting help. Do you see that stigma changing now that people are becoming more real in their conversations?
Thank you. That I feel I have some pretty strong opinions on stigma. I would say things are getting better, but they're getting better slowly. I've been working in the mental health world for 28 years now, and I can certainly say that there is a much greater openness that people have today to look for help, to recognize that something's not right, and to reach out to somebody to talk to it. So there's absolutely no doubt that over the last couple of decades, there's been some huge advances. A lot of public, corporate driven communication campaigns about being open and transparent about our struggles. They're tremendously helpful, but stigma does still continue even today to be the biggest barrier to people reaching out. I say that we can measure need by the numbers of people who reach out for service, but we also have to remember that there's a huge population out there that desperately needs help that are not willing to reach out and find it.
Can I just add what Mark was saying about stigma? And there's been this 2-decade or so campaign to reduce stigma, to allow individuals to feel comfortable to access care or to speak to somebody, and that's been wonderful. What has always frustrated me, and I'm sure Mark and the rest as well, is that in order to continue to reduce stigma when that individual does go and seek access to treatment, is that we need to have state-of-the-art, warm and welcoming environments. We need to have the latest technology. We need to be investing in research and innovation at levels that historically we haven't, I think, held up that end of the bargain towards. And so I think now more than ever, it's incumbent upon whichever government may be in power to really think not only about how much money they're investing, but how they're investing and how they're working with both community organizations and other quasi-government organizations to have an integrated planned approach towards mental health. Because, the saddest thing for me is that you have an individual who's finally had enough courage to say, yeah, I want to seek help. And then he finds out it's an 8-month wait for a psychiatrist, or he goes into a clinic or a hospital, and it just doesn't have that warm feeling as though that's a good therapeutic environment that they want to come back to. And so I think we have a lot of work to do, not only on continuing to reduce stigma, but also to ensure that there's adequate investments in place in a strategic way to ensure that that helps with the stigma reduction, makes people feel welcome to come and get the treatment that they need.
Mm-hmm. But there has been an increase in need, right? And Bonnie, you were about to speak before I started. That's something that you've been seeing. Do you want to carry on with that thread?
Yeah, I mean, I think this is such an important conversation, because the one thing that keeps me up at night is that when people are seeking the help, is it there for them, and how quickly can it be there? And when you deal with children and youth, that critical time where someone steps forward, whether it's a family member or the child or youth themselves, and says they need that help, if we are not there with open doors to provide it, or able to partner with someone in the community who can provide it for them if we can't, then we'll have failed. And I can tell you, I look at the the people who are lining up for our services right now, and my biggest apprehension is when you think of youth, and especially our children and youth, it's if they come through our door at the right time and we can provide the right intervention, the opportunities for their future are endless. If we don't and we let them sit, just like when I think of us as acute care, if you come in for surgery and it's early, we can help you. You come in 3 years later, who knows what we can do for you. And that's where I'm losing sleep right now. So, as much as I've, said at the beginning that I think there's been a real resiliency in some, the other side of that is I've seen people coming forward in a way they haven't before. And we're doing everything we can. But the reality is we need a lot more opportunities to be there for them in the place where they need us, as they need us, in the way they need us. And the other is for partners like us who are here today and others to really think about how do we work collectively. We know there's a finite resource. We get that. We all do. So how do we use it to the best ability to serve this community?
Okay, I want to continue on with this thread, but first, I want to look at a couple of other groups in terms of how they're doing and their struggles and opportunities.
We're heading to Q4, and the variant is surfacing in a significant way in our community. And of course, the choice point is passed, and parents have made their decision for Q4. And we had probably about 5,000 students returning to face-to-face where they had been online for the first 3 quarters of the year. They're changing their mind, and so that's indicative to me of the anxiety that all of us have experienced through this, parents and students.
We know that the public health measures and visitation restrictions at our continuing care facilities really were implemented, right, to protect this population who are most vulnerable to severe disease. But we also know that there was a price to be paid with these measures and restrictions, because it meant that many seniors ended up being physically separated from their family members and led to increased loneliness and feelings of isolation. So we've really tried hard over the past 13 months to strike a balance that would protect the elderly population from being exposed, while also ensuring that they enjoy socialization with the people they love. And beyond all of that, Albertans have also been dealing with anxiety. Anxiety is another big issue for us, being worried about the virus, being worried about schooling, employment, important aspects of their lives. And of course, there's the grieving. More than 2,000 Albertans have lost their lives to COVID-19. And each one of those deaths represent the loss of a family member, a loved one, a friend, a neighbor. And we know all of that has impacts on mental wellness.
We've got people that already have mental health issues like me, and all of the kids that come to the Little Warriors Be Brave Ranch, like they've already got stuff. So if you've got mental health issues, it makes it worse. This is a very unbelievable situation. And I think it's having devastating impacts on mental health. I don't think we've seen them all yet. Like the suicide numbers are up. Domestic violence calls are very similar on the increase as child sexual abuse calls, up 250%. I hope in my lifetime that I see our country, our province, as passionate about, domestic violence, child sexual abuse, cancer, all these things as they are about not wearing masks.
So Margot, you said something that I thought was very poignant. We all talk about how we're all in the same boat. You said, yes, we're all in the same ocean, but we're not all in the same boat. Do you want to elaborate on how that applies to Yes?
Absolutely. Yeah, I think it's a simplistic analogy, but it fits really well. You've got some people who are going through this pandemic on cruise ships, and then you have other people who are clinging to driftwood or nothing, and within our community. And when you don't have a safe place to call home, which is what everybody was told to do back a year ago in March 2020, go home, stay with your family and be safe. When you don't have that option, that's a terrifying prospect in itself. And on top of that, with a global pandemic that you don't understand, that becomes something quite terrifying. And on top of that, you've got young people who don't yet have the ability to make sense of some of the big picture pieces, who are still learning how to regulate their emotions, and to use their executive function frontal lobes to sort of make sense of impulses and where they need to go and what they need to do. And so what we see is we see trauma response. I've heard a lot of people make the statements around the term of post-COVID PTSD, COVID PTSD. Traumatic experiences are ones that hit us, surprise us. We don't know they're coming, and we can't do anything to get out of it or fix it. You know, you're trapped, and that's very much what's going on for these young people. And so you see a range of flight, fight, freeze, or fawn, which are the responses that happen in a crisis when our body, you know, sort of reacts. And so some of those behaviors can be violent, aggressive, getting bigger, being louder, because they're afraid, and that's their fight response. Some will fawn and try to people please and do whatever they can to get attention, which is problematic for young people as they're, you know, figuring out power dynamics. You know, you have some people who just run. And so it was very hard for us to have young people stay in isolation, just to get them to stay in one place for a period of time. And then you have some who are actually just frozen and living within substance use to just keep themselves going. And so, you know, we've been dealing with all of those all year, and they don't have the ability to travel, you know, to get some sunshine or to spend time with family in their houses or at the lake or whatever that looks like. It's a very different scenario. And that's what's, I think, made it it's become very apparent how much disparity there is between boats and crafts. And unfortunately, I think what happens is polarization. All of those trauma responses become fights, polarization between communities, and where our emotional responses are actually creating conflict within our community. They're, you know, the trauma responses that young people exhibit become problematic behaviors that EPS is called in, or, you know, school is called, or whatever that looks like. That's going on within our larger community as well. And what I've learned about trauma and traumatic experiences is that it's healed through relationship. So we have trauma caused by isolation. How do we fix that when we are still not able to connect? One of the things I'm very curious about, and I'm curious, Mark, Snattersey, I think I've seen a huge uptake because of the pandemic, in video counseling. For myself, we started doing it at Yes as well. We had to move all of our training online, as well as counseling for staff and youth. And I think that's going to be one of the ways, which is kind of counterintuitive because it is over screen, but one of the ways we're going to address this.
Yeah, you know, absolutely. There are some silver linings in the end that have come out of COVID. And one of those silver linings for us is it instantly brought us about 10 years forward in terms of our willingness and ability to deliver services differently, virtually, using Zoom, using video conferencing. We had a little bit of that happening prior to COVID, but when everybody's locked down, for many people, that was the only way that we could connect with them. And you know, after COVID is done, that's not going to change. I think we've opened up a whole new possibility about reaching people. In some ways, providing services virtually allows you to actually reach out to way more people using the same amount of resources. And our staff have become very adept at doing group therapy through Zoom, connecting with people individually through Zoom or through other virtual mechanisms. And so I think that's going to be a big part of our strategy to manage this wave of mental health and substance use problems that we know are going to be happening after COVID finishes running its course. So yeah, I would say that's when I think of a silver lining, that would certainly be one. It really pushed us to very quickly adapt how we delivered services and to do it in a much more innovative way.
And Pam, your organization is delivering virtual services. And, one of the things that we really need to talk about is how important that transition period is from youth to adult. And what happens with the gaps in the system. This is something that at CASA, as long as we've been doing these webcasts and lecture series for 4 years, we've been talking about this, and it doesn't seem to change. And now, Pam, that's why I get so excited when I hear what you're doing with Kickstand, because it's something that's really needed, not just in mental health, but in all areas. Do you want to elaborate on that?
Yes, thank you, Leslie, for asking this question. Our age range is from 12 to 25 for exactly that reason. Folks here would know that in the last 10 years or so, the developmental stage of emerging adulthood has been recognized as a distinct developmental stage that we have not been supporting appropriately. So as you point out, we have, and not just Alberta, this is across Canada and many other jurisdictions where there's a child and youth serving system for mental health and addictions, and then an adult system. And the adult systems, because of limited resources, tend to be more focused on more acute and chronic mental health and addictions challenges. And so almost all young people who are aging out of the child and youth mental health or addiction system are not caught by the adult system because they just don't meet the criteria. Some are. And I would just say a little shout out for AHS Edmonton Zone, who has recognized this and has a young adult mental health and addictions portfolio. I think is fantastic, and others should follow suit. So, we know that not only is this the age where young people, or I should say where mental health and addiction challenges are emerging, 75% by the age of 24 or thereabouts, it's when our system is the most fractured or siloed. And this is also where young people are trying to find themselves. And, as people have talked about, their identities are forming, they're moving out of the home, typically, maybe not as much through COVID, but it's a critical stage of life where we just haven't done a great job of catching those people, those young people. And so you're right, it's more than just about mental health and addictions. Sometimes what they're looking for is support around housing, of course, and Margot knows that very well. Often they're looking for supported employment support. Sometimes they're looking for financial literacy. They're actually, young people in this province have told us overwhelmingly that they're looking for supports there. So the idea with the virtual clinic through Kickstand will be to work with the folks who are here right now and many, many other partners to build out that holistic model of care to meet young people and their families' needs. I think Bonnie articulated it really well, at the right time, at the right level, in the moment that they need it. So we're really excited about this.
Okay, we're going to pivot now and move into what employees and staff are going through.
You can imagine, you've taught your entire career in a face-to-face learning environment, a traditional classroom, and all of a sudden you're asked to go and teach an online course for 2 or 3 months at a time. It's a challenge, and so they have to reflect on their practice and stay up to date with new technology and instructional strategies to do a great job in the classroom, and they are knocking it out of the park, but they're tired. And I think everyone is looking forward to the end of the school year so that we can get some rest and reset for the coming year.
Personally, from our individual members, I mean, it's been a tough year and a half. It's not just the pandemic. I mean, it's pandemic with a compound loss of jobs, a compound the social issues, and then George Floyd from the US. I think all those things certainly have taken a toll on our officers. I'm pretty proud and remarkably impressed of just how they responded in relation to that. But I think, we're kidding ourselves if we don't think that that's taken a toll. But I think on the other side of it too, from our public side, huge spikes in domestic violence. I mean, in relation to the nature of the violence within the actual offense, the severity piece is where the biggest spikes are. But our men and women, have responded admirably and continue to do that, even though it's like anything else. They're taking the risks on a daily basis with COVID as well. So we've had fluctuations in that. It's been way up. Sometimes we're up to 300 off. Got a lot better, but now the variant has hit us. So right now we have one whole platoon that's down. Most of it's due to isolation, but obviously positive cases too. So it's not an option not to go for us. So it's just a matter of trying to keep our folks healthy and trying to obviously have a sympathetic, but also bring some balance to our community. So lots of challenges, but we're hanging in there.
For me, the pandemic has been what I would say relentless. Like it has been relentless over the past 13 months. And from the start of March of last year, actually even before March, when we were starting to work on some proactive issues, knowing that we were coming into the pandemic, it just has been nonstop. If it's not a wave 1, 2, or 3, there have been issues around contact tracing, assessment centers for testing. Now we're into the vaccination rollout. I mean, it's just been nonstop. And so needless to say, our staff, physicians, and volunteers are also dealing with the stressors of not only caring for patients and Albertans, but dealing with how the pandemic has affected them personally, right? Because at the end of the day, they also have personal lives. So the stressors that I mentioned around schools and employment, stressors of not being able to be connected with their loved ones, it's been really, really hard. Just to give Albertans a glimpse of what's going on. Our people talk about the added pressure of making sure they follow all the PPE guidelines. I don't think people understand how tedious it is to have to don and doff off the personal protective equipment properly each and every time, and to be working 12-hour shifts as an example. Wearing the PPE all day, they get rashes on their face from their mask. They feel hot all the time because they're wearing additional layers. It's just very stressful. And then they talk about the fears that they have when they have to go home, because maybe they got the virus from work, and maybe they're bringing it home to their loved ones. So not only are they caring for those with COVID, but as I said, COVID has impacted on them personally. And then they talk about the toll on their mental wellness. I think the hospitalizations, the ICU admissions, the deaths that are happening on the wards, the stories of having to deal with, working with families where they can only have one designated visitors, or trying to keep that human connection to patients who, don't have the visitors that they want or the social supports. And, you can imagine all of those stressors, and it just, just pressuring up to sort of cause more distress. And so they're tired, everybody. And it doesn't matter whether it's the staff who actually touch patients or the staff who don't touch patients. Indirectly, everybody in HS touches patients. And so right now, they're working still on adrenaline in many respects, but sometimes that adrenaline is going to run out. We had almost double the amount of vacation time that people didn't take from last year because nobody could have the time to take time off. So that makes things worse.
And Bonnie, this is something that you talked about as well. It's been very stressful on staff. You've been open since right from the very beginning because you couldn't stop taking patients. Some online, but still doors open. What kind of impact's been on your staff?
Yeah, I think so much of what was said is true for us too. And that's that our staff are human beings with lives beyond their work. And so when you think about, going online for schooling, what does that mean for the people we're serving here, where we're trying to provide an in-person service, and all of a sudden they're online, and so part of the service is online and part is in person, and they're trying to adapt then to support their teacher colleagues, or they go home and their kids are now at home because they're not going to school anymore, and they're having to manage that and trying to figure out, how do I balance my childcare needs, with going to work. And so many of our providers, they also have partners who are providers. It was really an aha for us at how many of them were providing services as couples, just in different areas. And then all of a sudden, they're trying to balance, all of that. I actually think one of the things that has really surfaced for us though too is in mental health, and I know we knew this, but I don't know if we fully appreciated it. We get so much information from people's body and facial language. And we've had so many instances in this last while of dealing with young people where without being able to see their face, without being able to clearly see their eyes, it actually has put, you know, our staff in, I think, a place of not being as safe as we have been in the past, because we don't see the signals in the same way. And we've had a lot of really interesting conversation about how much we take that for granted, when then all of a sudden either you're not virtually in the same place, or you have so much of your facial stuff covered in having a conversation with somebody. So, you know, again, I go back to, I think just like our leaders in the community have just said, it's been both incredibly stressful and overwhelming for people. And we have had no reprieve. People have not taken time off. They're not going anywhere. Even when they are at home, they seem to still be wanting to connect with the work, because they know their colleagues then are shouldering that work. And at the same time, you know, I just am blown away that they're still here doing what they need to do. And again, so much appreciation for that.
So what have people done to try and make things better for their staff, and what are some of the opportunities that's come out of this? I'm opening it up.
I had mentioned earlier that we've gone through the process where we have therapists who work with youth, supporting group therapy and individual therapy and sort of emotional regulation plans. That team came back to us and actually lobbied for another position, and that is to focus on staff. So that's something that we had in our budget this year, to hire a psychologist specifically to support. We'll actually hire a clinical psychologist, and then one of the counselors we have will support our staff specifically. So she's set up already an online portal for staff wellness where there's resources and the ability to have fireside chats and have some of those discussions. So that's one of the things that we've noticed is working, is having somebody kind of, because we're all doing things on the side of our desk even more than ever right now. And so I don't know about the rest of you, but I've been quite worried about my staff. I know I'm not doing well in the pandemic. And I don't think my job's as hard as being a frontline youth worker or working within the buildings. And so I worry about holding space and making sure everybody's okay. And you can feel pretty helpless as a leader without access to, you know, a solution, or to think of create something on the side of your desk. So I'm quite excited that we have a dedicated staff person to focus on that for us.
I was really impressed, actually, talking to Dr. Yu. I mentioned Mark S. Because she talked about the communication, that how she's always been great about communication with staff, but really opened that up during the pandemic. That kind of sharing at AHS, it's really quite something with that large an organization. What are some of those initiatives that might help people who are listening, who are dealing with staff issues?
Yeah, Dr. Yu, I can't say much more to add on to what she said. It's very important to her, and it's very important to the organization. There is a daily communication that comes directly from our CEO, and it's probably the most well-read communication, because everybody looks for it every single day. It's updates on what's happening in the organization. It's updates on what's happening with immunizations and swabbing and pressures. But there is always in those communications some wording around taking care of yourself and around your own personal wellness, and lots of tips on eating healthy, maintaining a good sleep, looking after yourself, exercising, tips that you can do throughout your day to try to normalize things a little bit, take a break to regulate when you're feeling a little bit emotional. Strong connections to our employee and family assistance program and the broad range of supports that they have free for staff and their families. So it's been, it's been a really important factor in Alberta Health Services and other health, service organizations since the very beginning, recognizing that if you lose your staff, if you lose that resiliency, you just can't deliver services anymore. So I've been very proud about the daily messaging and the daily reinforcement that comes to every single staff and physician in Alberta Health Services about the importance of looking after themselves and taking care of themselves and their families.
Now, all of this is for staff. Is any of this open to the public?
Yeah, I mean, these communications are often very specifically to staff, but the breadth of support programs out there for the public, it does make it a little bit more complex in the world of addiction and mental health, because there are so many players. Alberta Health Services is certainly one of the key players in the servicing and the providing of services, but as you've heard today, there's countless other incredible organizations out there. And our challenge as a system is to create a system that people can navigate when there's so many providers out there. You have some excellent examples today of Kickstand and Yes and CASA and the Glenrose and when you have so many service providers out there, it can actually be challenging for people to find what's the right one for them. And so that is, as we think about this next wave, this post-COVID wave of mental health needs that the population is going to have, then we need to really support that and approach it from a system perspective. And I'm proud of the partnerships that we have in addiction and mental health. There's hardly anything that we ever do that isn't in some form of partnership with another organization. We've got fantastic relationships and I would include the police and schools and children's services and all those different service delivery areas out there. You have to work together so that our families and the people we care for feel like they're part of a system and not having to, navigate themselves and go to 10 different doors before they find the right one for them.
Okay, Mark, we talked to Councillor Scott McKeen, and he brought up something that definitely touches your area as well.
Yeah, substance use. Like Margot said, I mean, the increase in substance use out there is driving a lot of the social dysfunction. A lot of the time, it is a result of people are reaching out for substances because of the high emotional state that they're in. Sometimes it's trauma, sometimes it's the stressors of the pandemic. We've seen almost as many opioid-related deaths in Alberta as COVID-related deaths, which is tragic when you think about it. Absolutely tragic. And so being able to destigmatize people who use substances, being able to make sure that when there is a need for help, that they know where to go and they can reach out for help. It just becomes really critically important. And it's going to be our challenge over the next couple of years for sure.
Okay, we're going to go to Scott now.
So we see it in sort of subtle ways. People are crankier reaching out to the office. I think we see it in big ways as a community divides over issues like defund the police. I think there's a lot of frustration and loneliness and isolation and burgeoning mental health issues behind a lot of this. But what I fear is we're not hearing or seeing a lot of it. We know that, for example, we've heard that domestic disputes, gender-based violence is up, but we typically don't see that, right? We hear some stats. We've heard that alcohol and drug consumption is up considerably. We don't necessarily see that. It's going on inside a lot of homes. I think we're going to see I don't want to say tidal wave, that would probably be an exaggeration, but we're going to see a wave of mental health and addiction issues come out of this. And I think as a community and as a province and as a country, we have to recognize that and find ways to help people that won't break the bank. I think we're going to have to look at a lot more peer support, support groups in community, people reaching out and helping each other. And maybe that will be a positive that comes out of this, is that we'll see people being much more open to the idea of being really neighborly. That is my hope. I've got a 12-step meetings for years. I haven't hidden that fact. Mm-hmm. And that model, wouldn't work for everybody and it wouldn't work for everything, but it is at its most basic, 12-step is a community of support. That's all it really is. There's a framework built around it, steps you are supposed to do, but really it's the meetings and being able to talk about your fears and your failings and your frustrations into this community of support where you don't get any advice. You don't have somebody telling you exactly what you need to do. It's a loving, supportive community. And I've thought about how could we bring that out for people, call it COVID Anonymous or something, COVID Survivors Anonymous, because I think a lot of people are going to need support.
Okay, I could see a lot of nodding on that. What kinds of suggestions would you have for how we can support people coming out of the pandemic? Anyone?
Well, I think, yeah, that did really resonate with me, and a number of comments that have been made, of course, have resonated. For us, just providing a sense of connection for people through a period of isolation is really critically important. I completely resonate with the idea that, I think about that old adage, it takes a village. I know, Bonnie, you mentioned this earlier around really doing things differently, working more creatively, really, showing more love and kindness across all of it. I think will be really important. So, we will be pleased to provide. I know everyone has their own technology, but what we're also excited about in terms of the clinic, what we're calling Kickstand Connect, is that we will offer other organizations and people anywhere to connect through this technology on any number of different things, including, yoga classes and any number of different wellness activities. So I think beyond the, mental health is not just the absence of mental illness. It's so much more about what's in your life and how you're connected. And so I do think that that's one way we think creatively about how to increase opportunities for people to connect on any number of different things. It's certainly not going to replace face-to-face. I do realize that. But, one of the things that we've seen actually through our process, the young people that we've been engaging with for about 9 months now, have formed a community and have talked about how just this engagement through the development of the Kickstand initiative and our brand and our website has helped their own mental health because they felt connected. They felt like they've been able to contribute to something that they really believe in. And so I just, I just think that there's so many more opportunities to do more of that.
And also, I guess that sense people have of not being connected to the community in terms of services that they can access. And Mark, yes, that's one of the things that was brought to my attention is your 24/7 triage that you've set up and the applications that can have across the board. Can you tell us a bit about that?
Sure. We recognized after talking to so many families and people about what their journey was like, it was far too common for people to have to knock on many doors to try to find the right door for them. And often where they ended up looking for help instantly limited them in terms of what supports became available. If they walked in this door looking for help, they would have access to those services that were behind that door. But it would be a very different experience for them if they had reached out somewhere else. And so we had this vision of creating a centralized front door where anybody could walk into, anybody could phone into, and if they weren't able to come in, then we could go to them. And after understanding what their needs were and having a conversation with them and really understanding what their individual and family needs were, then we could get them connected to the right service. And so we opened up something called Access 24/7 almost 2 years ago, and it has become our front door, and it's become the place where people go to for help. One phone number, one location. I have to say they're extremely overwhelmed these days with the increasing numbers of people looking for help. It doesn't mean that everybody who connects with Access 24/7 is going to be connected to an Alberta Health Services. It may very well be that we provide them a supportive handoff to get them connected to a family doctor if that's what they need, or another agency that provides excellent supports that aligns with what their needs are. So we're really trying to take the system navigation away from you know, the public and having them have to navigate our complex system for themselves, and to create one place where we can navigate the system with them. And I'll say it's not perfect, but it's certainly it's taking us in the right direction, and it's certainly getting people connected to services much more appropriately and much faster than they were before.
And the integration of those services is really important to mental health as well. Mark, can you talk, Kay, can you talk a bit about how mental health has such a huge impact on your physical health as well?
Yeah, I mean, obviously they're interconnected, and you can't have one without the other, and vice versa. And so, you know, one of the things that's really important to me, and where I advocate for with respect to mental health, and Pam can speak to this better than I can, but it's just around the integration of both health and social services, the social determinants of health, to ensure that your mental well-being is optimized, not only through looking at psychological constructs that are maladaptive behavior psychologically, but also looking at your physical health, your eating, and other aspects. And that's why I've been such a strong advocate for Kickstand, and the work that Pam's been doing is to have a provincial body that can streamline those services so that there's equitable access across the province for those type of mental and physical health modalities for those in need. But I'd let Pam maybe speak a bit to the integration part, because, you know, that's what Kickstand's really intended to do.
I think you did a good job there, Mark. I would just add that, you know, what we hear from people, and this is not just for young people, all of us, I think, we don't want to have to repeat our story several different times to several different providers. And so if we're able to integrate and the other thing I would say actually is young people don't necessarily care which organization is helping them. Of course, I know that a lot of people have really strong relationships with people with an organization, and so there is trust there. Having said that, though, they're often just looking to get that support. And so if we on the back end can work together as organizations to ensure a seamless experience of care based on what the needs are and how those needs change, then that will make it much more a much better experience for young people and their families. They won't have to, as Mark Snattersey was describing, drive to a number of different doors and be told that, you know, they don't meet the criteria for that programming. So, and through Kickstand, if we're not able to provide the support that they need, if they're looking or they need something a little bit more intense, then we will be working with others to ensure that we get them to those services, and that we as service providers are communicating and sharing information so that the young people and their families don't have to be doing that.
And Leslie, could I just add a non sequitur comment? Because you had asked, you know, what can we do going forward, and there's a few things that jumped to my mind. And first of all, broadly speaking, I think that for far too long, mental health and mental health care has been not recognized on equal footing as other elements of physical health care. And, you know, we talk about investment in terms of dollars, which I'll talk about a little bit now. But when I use the word investment, I think about it in a lot of different ways. And we also talk about transformation of the system, transformation of how we deliver services. And so going forward, you know, I think it's incumbent upon all of us, not to think of each other as competitors for dollars, competitors for clients. We need to look at the system from a client centric or patient centric, and then figure out what they need in order to optimize their well-being. But also from the investment side, when it comes, and I'll talk about, you know, the provincial government, but there's other funders as well, as, you know, how they design and deploy their investment criteria for funding, both to Alberta Health Services, but also to community organizations, I think needs a real rethink, because again, it becomes this point where it's kind of pigs at the trough, everybody trying to fit within some sort of narrow criteria. That's kind of the soup du jour. But I think there's a much better way by which that we can look to access limited resources, capital, and work closer together in a way that, blurs the line between what organizations doing what. I think gone are the days of using the words competitor in the charitable and non-governmental space, and that we really need to think about, if this is such a systemic issue that we have in our society, we need to do better ourselves collectively as leaders in this area.
That's incredible. If it's okay, I'll jump in as well, because I think that's also one of the things that we can do right now for our own mental health. Collaborate. The collaboration and the creativity that has come out of this crisis is incredible. And it's what has kept me going through this, is this group. I have a number of collaborations or coalitions going around these same areas, some mental health, some on youth experiencing housing instability. But the partnership, the camaraderie, the problem solving, and the creativity together between organizations is providing energy within people. And I'm noticing that. I'm hearing it from my colleagues who are saying, like, this is what's keeping me going. And I think we forget as leaders too, self-care and mental health robustness in the workplace and in culture isn't always yoga and meditation and spa days. Sometimes it's, most of the time, it is empowering people so that they can do incredible work and feel value. And so taking advantage today of the creativity, the appetite, there's less risk aversion right now, and people are being forced to change. So let's make it real good change and strategic change. There's so many sort of conditions that are making this right for things that are really meaningful. And that's where we're going to feel connected and take care of ourselves, I think.
And I just, Leslie, sorry, but on the innovation front, because Margot kind of alluded to that too, as much as this has been such a terrible period of time, it also allows for innovation like never before. And so you just think about, Alberta Health Services and how they were able to deploy and redeploy and vaccine and all those things. And then you think about virtual mental health care. I think it might be an Ontario stat, but I think like between February and April of 2020, telehealth went up 750%. And so, whereas they spent the last 10 years arguing over whether or not we should do this, what platform, blah, 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 blah. And then next thing you know, it becomes something that it's not a question of if we should, it's that we have to. And then you realize really quickly that you've wasted 10 years talking about stuff that you probably could have just implemented if somebody had the audacity to take a chance. And so I think there's more of that to come in the mental health space as well. And so I'm excited to be aligned with partners like people on this call and those that have called in, because I think everyone's aligned in the fact that we can do better. And now is the time to test novel treatments, collaborate more closely, and break down the barriers that have often existed in the competitive landscape of trying to seek very, very, very limited resources in mental health. And so, and our young people need that help. So.
And Leslie, if I can just speak to one other thing, as my colleagues are talking, it actually just gets me excited because I know this to be true. We're not just talking about it, we're trying to do it. But there's another thing I don't think we can lose in all this. And that's that at the same time we had a pandemic, there was a whole social movement happening out there. And we were all paying attention and watching it in a different way. And if one thing has resonated with me, not only in how we are adapting through and we will through the pandemic and the other side of it, is one of the things that our staff have really been talking about, and we've been having conversations as communities, and I've been having conversations in my home, is how do we provide services, mental health services, social services, whatever it may be, that is for the person sitting across from us. Not the way we interpret the service to be, but the way they need us to deliver it. One of my children said it so eloquently, Mom, that's going from the golden rule to the platinum rule. which is I'm going to do unto you as you want done unto you, not the way I want to do it. And I think we cannot lose this through this crisis. I think people are stepping up and saying what they need, and we've watched a whole social movement. And not only do we have to do better as organizations and working together, but we have to hear what our community wants, and we have to deliver it in a way they want it done on to them. And I think there's some real power and energy in that if we think about how that's possible.
I'm really excited about our next session when we get to open things up and hear from people, not just their questions, but their comments. So that should be a pretty dynamic episode. There is one last thing that I want to touch on that we haven't discussed yet, which is kind of interesting, and that's vaccines and masks and the implications of those. So we'll just hear this first.
I think not everything has been terrible in this time. There have been like innovative ways to connect and provide programming, less barriers, I think, for accessing supports in some ways because of the time that we're in and the challenges that we're all facing. And so some of the things that they needed to support them have been really barrier free, whereas previously there was numerous checkpoints. The vaccine was a much welcomed bit of news for our community, for most of our community, I'll say. Not everybody though. So we do have, and I don't even want to call them anti-vaxxers because it's not that they're anti-vaxxers. It's that, that there's a historical relationship with the Indigenous community in this country. And we've never been put in front of the line for anything. And so there was suspicion from, especially from the seniors in our community, around being put to the front of the line for this brand new vaccination. And so there was this suspicion around what's in there and why are they putting us first? They never put us first. So we heard from a lot of our seniors that there was a lot of hesitation in getting the vaccination. And so we really had to work hard to convince them that this is really to protect you.
And, I can tell you in the country, there's never been a protest for kids being raped, human trafficked, or child pornography. But there's been how many of them for masks? I mean, I'm worried that we're not going to get herd immunity, which is 83%. I don't know if we'll get it in Alberta, right? Like there's so many people against the masks and the vaccines. I don't know if we're going to get it, right?
It's on us why this infection continues to spread. Unfortunately, with the variants, it's spreading faster and with more ferocity than ever. But it's on us to try to control it and our own personal discipline. So I see that even as frustrating as this is and as hard as this is, for us to continue to adhere to all these barriers and these rules and these restrictions, I see that we will do it. I have great hope that people recognize that this is the only way out of this pandemic and into that freedom that we used to enjoy. Even if it's freedom where we have to wear masks in some settings or still maintain some distance, we'll have a lot more freedom and a lot more liberties than we do now. We've got to get there. We have to get there for all kinds of reasons, to start to rebuild this economy, to start to rebuild our mental health and well-being. We've got to get there. And I think we will. I really, really am bullish on our future. And part of it is helping us recover from this and get back to whatever that new normal is.
I often during this pandemic think about the pendulum and how it swings to one extreme, and that extreme are the anti-vaxxers and the one way. And I think it's challenging sometimes to understand that, but it's real. And I think maybe there's an opportunity here to close that gap, to make us more whole, to stop that divisiveness. If we understand where we're coming from, how do we do that?
I can speak to what's, some of the things that we've seen at Yes. Because it's difficult when you have a population that you're trying to take care of that may or may not buy into the restrictions and the rules that are coming. Teenagers need choice and autonomy. That is just one of the two of the tenets that really goes across sort of the case management, making sure that they have that sense, which has been taken away this year. And is typically often something that we play with or use with teenagers to control. And the other thing that you have is a distrust of adults. There's a power imbalance, and a lot of young people have been hurt by adults, by the system, by children's services, or by parents, intentional or not. And so it's very hard, again, to have a system that they don't trust dictate something and have them buy into it. And so you start by building trust. That's the first thing you do. And trust is built by doing what you say you're going to do, being consistent and predictable in that. And slowly, it takes time. And so communication, making sure that really all the facts are out there, and then providing as much choice and autonomy as you possibly can within that scenario has worked for us.
So on a wider scale, have we lost control with the internet? How are you dealing with that at AHS?
Well, with regards to getting the vaccine out there, we had to come up with a whole bunch of systems very, very quickly to try to make it as accessible to the population. And I think we've done a pretty incredible job of it. But we've already identified certain groups out there who have vaccine hesitancy. I don't want to call them anti-vaxxers, but just like Margot was saying, there are certain groups out there where we need to understand what is their background, and what interactions have they had with the bigger system that have perhaps created this hesitancy to go along with what the public messaging is. So I know that within Alberta Health Services, we're trying to really understand those populations. It could be the Indigenous community, it could be other ethnocultural groups, and to really spend some time understanding what are the barriers, what are some of the factors that there is hesitancy there, and is there a way that we should perhaps be administering, delivering, making the vaccine available to that group differently, in a way that would be more culturally or socially acceptable to those groups. So I do know there's a lot of work going on across all 5 zones in Alberta Health Services to really reach out to those groups where we do know there is hesitancy, and to understand the reasons why, the underlying reasons, and then to work with them to perhaps adapt the way that the vaccine is being made available in a manner that will be more accepting to them.
The third part of this series that we're doing is going to be about where do we go from here. But in the meantime, does anyone have any suggestions about what we can learn from what we've been through so far? We've all talked about, the final wave of the pandemic being mental health. What do you see as being possible solutions going forward? How can we make this better?
I might just add that, we've talked a lot about resiliency and also, distress and overwhelming situations, and also mental illness. And I think that, it's important that people understand that they can both be resilient and also struggle at the same time. It's not one or the other, and that human beings are extremely resilient. However, when you're dealt with stressors and situations that are unprecedented and surreal, it's a normal biological reaction to respond in a certain way. And if you've already been in a position where your mental health has not been optimal, it's understandable that you'd be further compromised with your mental well-being. And so again, where we can go from here is, a lot of it comes back to some simple things, some system things from my perspective, but Margot mentioned collaboration and the sense of community, and I think we've lost that a bit over the years with technology pushing further and further into our lives. And so reconnecting with your community or your tribe, and having that tribe with you through thick and thin is one integral part. And that could be family, that could be friends, that could be whoever. Treating your mental health just like your physical health is another thing. And so there's no shame in having a therapist. It's just like having somebody to help you work out, to lift weights, and then your physical health. And then those three baseline things, I think every individual should really strive for. I know it's difficult, but strive to think about on a daily basis. And then if all else fails, we need to have a system that's designed, that's patient-centered. And all of the groups that are in the space of addiction, mental health are aligned on a broader vision of what exactly we're endeavoring to do with that system.
So much to talk about, so little time. Bonnie, did you want to add one more thing before we move on?
Yeah, the last thing I want to say is the one thing I really aspire to for all of us is that as we create the new normal, that we don't forget what we're learning here, that we stay present in this, and that we don't let this then become that thing we don't talk about anymore because, well, we got over that. So I always want us to remind ourselves being present in this right now and reminding ourselves what we're taking from it is going to be critically important so we don't lose going forward.
Okay, we're going to hear final words. Go ahead. Go ahead. Did you want to say something, Margot?
Yeah, I think just be easy on ourselves. I started out the pandemic thinking I was going to get a rock hard athlete body back and, achieve all these goals. And I've wheedled that down to just go outside, just go outside and drink some water.
Or how about the huge population of us who are trying to figure out how we're going to fit into our old clothes again, because we're enjoying food and wine and we're not getting as much exercise. So that's a whole other discussion.
I'm sure your local business will be happy that you go shopping again.
Oh, good point. So we're going to get final words from our leaders and then come back to final words from you.
It's amazing to work with such an incredible group of people and an incredible group of parents and kids. And so we're going to get through this, but there's going to be some difficult times ahead for all of us as well.
It's time for a rethink on a lot of these things, but it's not just a rethink of policing. It's, walk outside on the streets and look what's going on and wonder if you can't do better if we get everybody going in the same direction. So we need to be that stabilized voice to bring the calm and try to get everybody going in the same direction. And that's our commitment going forward. But, we'll bend, we'll never break, and we certainly won't react or act on rhetoric. And honestly, we're going to start partnering with organizations and people and groups and not-for-profits that are going in the same direction, because we can't no longer just talk about this stuff. We got to focus on the ones that are actually really to take some action and get some things done. Meaning we might make some mistakes, but if failure is what we have, then there's only one way but up, right?
Look at the incremental change we've seen, the sheer volume of new ideas and new approaches and new perspectives we've been able to design and grapple with in the last year. I mean, our capacity, I believe, is much greater than we give ourselves credit for. And when we're pushed, when we're strained, when we're stressed like this, I think we really rise to the challenge. And so I believe we'll continue to do that.
And I really appreciate even you facilitating this, because a lot of people are dying from COVID-19, especially in Alberta now. Yeah. It's out half of our elders. So we're in a complex situation. On one hand, we are scared because there's, trust that we need to build with systems. On another hand, we can't survive without the system. So it's weird. You're in like a limbo and you don't know what to do. And there's a lot of conspiracy theorists. I'm sure you all know this in terms of what's going on, and it's just horrible. So navigating all of this itself brings a whole mental health issue. Even for frontline practitioners and medical doctors, believe it or not, they're complaining about mental health as well. So I know it's cliche, but we definitely are in this together.
We've got this shadow pandemic of mental health issues, no question, during COVID. And my hope is that we learn the right lessons. We don't learn the wrong lessons, that we don't divide and fracture into a bunch of groups throwing rocks at each other, but in fact we come together over this. That I hope that's what comes out of it.
But I think at the end of the day, I think it sparked a really great dialogue, especially on social media platforms where people are seeking to understand and seeking to learn more. That's been my experience anyway, is that I'm learning lots about other people, and other people are being curious with me. And so that's been, I think, an upside of some of the things I've been experiencing for sure.
And now that people can safely relate to mental health struggles, because it impacts all of us, because COVID has impacted us all. So now I'm hoping that the perception of it being a sign of weakness or something that you've done wrong will shift a little now that it's like, oh, I can link this to COVID and this shared experience that we've all had. So it's not just me, or won't be seen as just being me.
Is it a wake-up call for society to do better, to be better, to love more? I hope so. You know, like, I hope so.
I think one of the challenges with our employees also is that because they're caregivers, their first instinct is to care for others and not to care for themselves. And we're saying to them, you know what? You got to care for yourselves, and you got to have the self-compassion. And it's okay to look after yourself as number one, and don't feel guilty about it, because if you can't look after yourself, you won't be able to look after others.
Pretty great words of wisdom. To lead off, final words, Pam, would you like to lead off? And what I mean by final words is, with all the things that we've discussed, what would you like people to know from your perspective?
Well, that's a big question, really. I appreciate it. You know, all of those leaders that you just showcased here, everything that they said resonated with me completely. And I think it is, you know, and Margot spoke to this too, really first and foremost, taking care of yourself and knowing when, you know, like I've had folks on my team say, I need, you know, a personal day. And of course, there's no questions asked, that happens. But you know, showing more love and kindness and self-love and kindness, I think if we were all able to kind of do that, you know, we will get through this, you know, in a way that will set us up in terms of being healthier moving forward.
Good. Bonnie, Margot.
I think the most important thing right now is like what everyone has said, is to stick together. But I also heard and got very excited from hearing our leaders say it's time to fix some things. It's time to stop just doing something for the sake of doing it, and look how much power and efficacy we could create if we were all working in the same direction. So let's hold them to that. Let's hold ourselves to that, and make sure that we fix the things that we need to, and we do it together, and we seek to understand what we all need to feel healthier.
Mark Kay?
Yeah, I would just add, you know, I think of us as individual nodes in a network, and that, you know, you're not just one person. You're one person that's connected to maybe 1,000 person. And so that makes you one person away from 1 million people. And so I would just say to people out there that have the capacity and have taken care of themselves and have the ability to look after others, is never underestimate the power of reaching out to someone, and never underestimate the power of giving someone your ear for a half an hour or an hour. Because that doesn't only impact that individual, I think that has ripple effects across the network that you can't even really understand. And so I think that's critically important for us, you know, as individuals, and then collectively as a community, that, you know, when you're hesitating to reach out to somebody, the default should always be yes. Don't think twice about it, just do it. And then the other thing I would say is, you know, if you're feeling in a mentally compromised place, don't hesitate to reach out to other people too, including myself or any of us on the panel. It's not like I'm on this panel because I'm this mentally optimized individual. It's because I've lived through challenging mental experiences myself, and that I have a personal interest in understanding how to improve the system myself, for myself, but then also for others as well. And so we're all imperfect creatures trying to navigate a very complicated world. And so give yourself some grace.
I see another webcast in that theme. Bonnie.
I would just mirror what my colleague said, but maybe I would just say one thing that I, again, am pretty passionate about, is that I think all of us here care. We care about ourselves and each other and the community, and we care about mental health. But the onus is on us as leaders, not just here, but the ones who are on the tape as well, to act. And as much as I'll hold myself, I love Margot's comment about being empathetic to ourselves. We need to hold ourselves accountable to that, because we have a responsibility. And when I go home, I have a responsibility to my children and to those who have struggled with this issue. When I go into my community, I have a responsibility to my community and my neighbors who struggle with this. And I'm with Mark. We're not perfect in these seats, but I think if people can hear us, we care, and you're hearing, and we're willing to act together to make a difference. And so I just want people to know that we've got that commitment from many of us, and I truly believe that that's going to help us move forward.
Wonderful. Mark, yes, we sort of saved you for last as our esteemed guest in this coalition. Your final words.
Well, I think today people have heard about how we're trying to improve as a system and to be easier to navigate and to be more integrated. But believe me, we are not perfect yet. And I would suggest to anybody who has attempted in the past or maybe hasn't had a good experience trying to reach out for help, don't give up, try it again. And if that doesn't work, try it again, and don't give up on yourself. Someday our system's going to be perfect, and we won't have some of those system navigation challenges in the past. I think we are slowly improving, and we're getting there. But don't give up on yourself. And if you haven't had a great experience reaching out in the past, don't let that stop you from trying again. And just my final comment is I don't think there's one sector that kind of is responsible for supporting this, the mental health needs of the population. It really, I think what we've heard today, it really needs to be a holistic and a whole societal change. Everybody has a piece of this, the healthcare sector certainly, but same with the social sector, the religious faith-based community, rec centers, municipalities. Everybody actually has a very significant role to play. And I think that's what we will see over the next few years, is a societal response, and much more working together in partnerships and not so much in silos.
Wonderful final words from everyone. I'm just so grateful to be a part of this group and to be a part of this coalition. And I just want to say thank you for everything that you give and for your wonderful comments today. Hopefully there are people out there who were touched, and will continue to watch in this series as we bring forward more options. So thank you very much to our panel and our partners, and thank you very much as well to our people who offered all of their comments in the interviews, to the leaders in this city. Very impressive group. So thank you. Two of our panel members, Bonnie and Margot, were guests on Global News Morning Edmonton, talking about this new mental health coalition. You can watch a recording of their interview at globalnews.ca. We'd also really appreciate if you could share your thoughts about this session by taking our survey. Just click on the link in the description below. Your feedback is really important to us in keeping these sessions relevant, informative, and enjoyable. And coming up next on Thursday, June 3rd, a very special part 2 in our series. It's Our Mental Health 1 year in, What's on Your Mind? This is a live stream event where we're putting together a panel of mental health experts from a cross-section of areas to answer your questions about parenting in the pandemic, trauma, PTSD, youth, addictions, and much more. We'd love to hear from you. Send us your comments or questions in advance with a video from your cell phone or by text. You can go to any of our partner websites for details and links. That's casaservices.org, yes.org, glenrosefoundation.com, and mykickstand.ca. On behalf of CASA, Yes, the Glenrose, and Kickstand, thank you for joining us. I'm Leslie McDonald. Be well and be kind.